I'd like now to invite you all to focus on the discussion. We've had lots of questions coming in. I typically go through the questions in the way, in a way that reflects your voting. So if you haven't voted, please do so. I'll keep refreshing the screen to make sure that we follow your what you like us to address first. Given the number of questions, I think we will struggle to answer them all today. The first one is for you, Elizabeth, and it's from Sarah Desmond, who says, "Thank you for your presentation. How and when do you screen for domestic family violence, and if domestic family violence is indicated in the course of work with a family, would you report and continue to work with them, or would you report and discharge? How do you ensure that all members of the family feel safe to talk in front of each other?"
Oh, there's so many angles to that question, but I also would really just like to call out Hasiba's beautiful presentation, and what a lovely piece of work. Aren't you lucky to have her on your team? But also, the warmth and the appreciation she has for the family, and so beautifully talked about holding them all in mind, which is the art with family work. So just really struck by that lovely piece of work. In terms of domestic violence, certainly what I do in terms of screening my own clients, and we do at Relationships Australia, is we do ask at the point of intake, when people are certainly describing conflict, whether there has been violence or abuse in the family. So often people will say no at that point because they haven't thought about it that way, or they're not ready to call it out. So it's only one point, but it is quite important to ask it so that you can plan the work. So what I find is that if I'm working with a family, and because it's in the stream of conversation, as soon as people are talking about conflict, as I say, or if I might ask, how does this family, or how do you as a couple disagree? What do your disagreements look like? I open as a very open question. So if I was a fly on the wall, how would I see you argue together? Does everybody feel safe to argue in this family? What's the worst fight you've ever had? I'll often ask it in these conversational ways. Does the fight ever get more physical? Does everybody feel safe to speak up? So I will ask it in these sort of open ways, because for many people, as we know, who experience abuse and violence, they're often not even seeing it like that. They're seeing it as a bad fight, or remember that awful time we had. They're not thinking, yes, I'm living with violence. So sometimes the therapist is the first one to call it out. So certainly I do not report and discharge or see that as the end of the work for me, but it is true enough that best practice is not that if domestic violence is disclosed that you would continue to work in individual counselling with a perpetrator of violence or a user of violence, nor in couple or family therapy. The first instance would be to, and what we can do, we're lucky at Relationships Australia, we have programs for people using violence, so we can say, look, did you know that we actually have a special program that particularly assists those who are using these sorts of behaviours? Because usually in the interview, you've generally found out that the person is not happy with their behaviour, or will say, no, that wasn't ideal. And you see if they are actually willing to be referred. And certainly if you're working with someone alone in the room who discloses this is happening at home, to refer to services that can be best placed. But I tend not to see couple counselling or family therapy as the place to work with a person using violence. It's more the place to shape up the referral and then to continue to see them in whatever way I can.
Thank you, Elizabeth. We'll go to a second question today, which is from Ivana Kovac, and reads, what strategies do you use when working with men in the family therapy context specifically, particularly in instances where they may be reluctant to display vulnerability in front of other family members? due to culturally ingrained norms about stoicism, toughness, etc.? And that's a question that maybe I can get views from both of you.
Hasiba, would you like to answer first?
I would love to. If you could just repeat the question, please, because I didn't hear it.
Sure. It's about what strategies do you use when working with men in family therapy? Specifically, in instances where they may be reluctant to display vulnerability in front of other family members due to culturally ingrained norms about stoicism, toughness, etc.
Yeah, that's a great question. And I love that because this was a challenge that we do face significantly working with culturally diverse background where counseling is just not normal. For me, relational based statements reframe. So reframe, I a lot of the times I say to the clients that I can imagine that being here is very strange, that coming to talk about feelings is not a normal everyday thing that you may be used to. However, I can see that you being here takes a lot of strength. It takes a lot of courage for you to be here because to me it shows that you want change, that you want things to look different. And this almost always works out pretty well where they're able to, because I'm showing them that it is hard. It's not natural for a lot of them to come and talk about emotions. It's not a natural tendency for it to happen. So validating their experience gives them the permission for them to start and talk.
I think that's a great answer. And just to add to that, there is some research, and I've written some of this up myself, about men's experience of therapy. And it's important that we think about ourselves in the therapeutic system, that we are trained to talk. And it's a highly feminised industry. So there we are as women who often talk a lot, and me being one. And also therapy is a process of creating dialogue. So we are all set up for people that talk back. So anybody, whether female or male, who's not used to opening up, we're all ready to work with the one who chats, and the one who doesn't chat it can be framed as harder to engage. So when you think about that, research demonstrates that women are 4 times more likely to have discussed the problem with all their friends before they come in. So they've had practice. Women have had a lot of practice discussing the problem, whereas men have often not talked to anybody ever before. So again, they come in, the women, so how do you see the problem? And the women are all ready to go. They're ready to chat, and it makes the man feel even more inept or out of his depth and potentially more marginalised. So we've really got to think about that, about how we also could reinforce that. For me as a woman in the room talking to a woman who's ready for a chat, how we set up a gendered dynamic around that. I also, as Hasiba has indicated, I will often really normalise the reluctance to be in the room, to say, to really just call out, you look like you'd rather be anywhere but here today. Also, it's great you came to make a contribution because your perspective will be really valuable. And so I just start by saying what they've got to say will be really useful. And then I can just start to work with that. But I also really normalise, well, of course, as independent grown-ups, none of us would prefer to ask for help. And particularly as the head of the household, for some people, that would be harder because, and I might even just say, look, a lot of people feel coming to a counsellor is a real sign of, gee, we must be hopeless, or maybe our relationship is over because it's such a serious moment to ask for help. And I just, I also say most people leave saying, gee, I wish I'd done this earlier. We could get some assistance here.
Thank you, Elizabeth. I might throw you a question. There's a lot of questions about interpreters that are coming up. How do you deal with these dynamics of involving another family member, a family member that perhaps is not participating as fully in the discussion, when there's that delay, you know, in terms of things being translated to you through an interpreter?
Look, I think it is very difficult because the work slows down. But in another way, when you're working with a family in the room, as Hasiba finds, is that it is all about setting up, that developing trust, that everybody knows you want their perspective. So that even if the process is slower, whether it's slowing to listen to somebody else, even just as they're speaking, let alone with an interpreter, that it's also building trust that you want to talk to everybody and that they can use that time to reflect on what they might say. Whereas if you get very engaged, say with the parents or the person who talks most in the family, sometimes that person will just already tune out and say, oh, well, this is going to be an adult to adult conversation. I'm not even going to be part of it. So I think making sure that you start a session, greeting everybody, showing that you're already willing to talk to everyone in the room. Don't just start necessarily, you've got to respect hierarchy, but not to show that this is about parents coming to talk about the children, but it is a family conversation where everybody's views is welcome.
Thank you. There's actually another a question about interpreters, and then I might throw another one in that direction. And maybe this one, Hasiba, you can start. The question comes from Tariq Bakhtani and reads, for smaller communities that know each other, sometimes it may be difficult for families to share in front of the interpreter or bicultural worker. Some families will not share all of the points. So how do you go about this issue?
That's a really important question for us because the use of interpreters is really prevalent. I have myself barely use interpreters because I work with a lot of the people from similar background or the languages that I speak. However, I think it's important to create a shared and safe space to say, look, here we're going to be discussing these things and there's going to be personal things. It's really important that everybody here feels safe, and that includes the interpreter. So if anybody feels like they can't share because of either a person being present here or anything else, it's important that we talk about that and that you let me know as well. I think it's important that there needs to be some sort of rules that need to be set, that we're going to be making sure everyone feels heard, as Elizabeth said, making sure that everybody feels safe enough to open up and talk about these things. And that, yes, so working with people from similar background, people do feel scared that their stories will be shared in the community. There's a big fear of that, and that needs to be acknowledged.
Thank you, Hasiba. Elizabeth, any views on this?
Oh, look, I think Hasiba's answered that very well. I think there is certainly something about trust and safety, and that reassurance often when you've got a lot of experience, calling it out up front at the beginning of the session, to acknowledge it's a small community, and just to particularly assure people of what is said in the room will not be repeated unless there is a reason for disclosure, and explaining all of that is just incredibly important for people's protection, and so that reassurance will go a long way to building that trust.
Thank you. I mean, it's such a complex issue. Certainly, it's probably what I found the most difficult, working in a family therapy context with families through an interpreter. So the other question I wanted to ask is, when, we talked about men before, bringing them into family therapy, if the interpreter is a male, if the interpreter, whether male or female, is younger or older than the parents, or clearly they're always going to be older than the children. How do you manage this, and how do you work with these subtleties, particularly in the beginning of therapy?
Yeah. Well, I think you've got to really declare the differences in the room. You know, if I'm not the same cultural background, or I'm not the same gender, or the interpreter adds another dynamic into the room, that you do acknowledge it from the beginning. And I should have said before, so say there's a man there, a female partner and daughters, just to say that, you know, that he is the only one in the room who's going to represent what it's like to be a man in the room. So his view is particularly important, and I acknowledge, look, I'm not a man, so there may be things I miss, or I'm not of your cultural background. Or if the interpreter sort of adds weight to one gender or one perspective through age or whatever else it might be, I think saying it, look, just looking at us in the room, it might feel like generationally we don't know your experience, so you're the expert on that. And we need to give you room to tell us what we're missing, what we could miss by not having that experience. And I think then by calling it out, it's the best way to deal with things, because if you try and take it into account through the interview, you could end up falling into unconscious behaviours like placating, over complimenting them, you know, almost overdrawing them out. Oh, you must feel uncomfortable, so I'll just spend more time with you. You do these things sort of unconsciously because you're so busy thinking, gee, I better make them comfortable, I better make it all okay, that as a therapist you can get influenced by that, by instead just being transparent and saying, look, this is going to be a difference we'll need to navigate. How are we going to do this together? You've already declared that you're aware of it, and you start a conversation about that. I think it stops us falling into accidental behaviours that aren't going to serve anybody well.
Hasiba, you got any views on this?
Yeah, I think it is important to acknowledge it in the room. One thing that I did mention in my in my presentation was that relational statements. So being able to talk about concerning behaviors, but in a relational manner, and they can be different, right? So the dad is screaming, the mom, it probably has something else, and the kid, and you're able to make this problem relational because they're all suffering. They're all going through a complication, a heartache, a pain, even though it's caused or impacted by different members in the family, but they're all sharing this concern, this ache, this pain. So when you say it in that manner, everybody feels heard, and that balance of alliance, so nobody feels like you're taking their side. Everybody feels like, okay, well, maybe I'm being seen, and then you can check in. Does that sound okay with you? Does that sound like something you're feeling? And you can go individually to different members of the family and check in with them.
Thank you, Hasiba. There's quite a few questions, so I'm going to try and get through some of these as quickly as we can. Thank you both. This comes from Holly Kacha and reads, thank you both for your insightful and concise presentations. A question for Hasiba. I wonder if you might describe a little more of what an early session with the family looked like. Hasiba?
Yeah, so another session with the family, I actually stopped seeing the family as a whole because the family was feeling extremely overwhelmed, just the whole resettlement journey, which is why it was so important that different members of our team are working really closely with the family members. And then I continued working with mum. So I'm not seeing the family collectively anymore. But for, I guess the point, a really big part of my presentation was that we need to take into account when families are coming in to Australia, and then we introduce them to therapy and we get them to go individually, it can be really scary. It can be like, for example, parents feel like, okay, is my child saying something that we may get in trouble? Is my child being taught something? There's a lot of mistrust. There's a need to understand what's going on. So more than anything else, that space where the family was able to understand or learn to name emotions was a massive achievement for me personally, because that's where they started being able to understand what's happening for each family member or collectively within the family. So I guess that was a longer answer, but I don't work with the whole family anymore. I would have loved to continue, but because of all the other dynamics that were happening, we thought it was best for each member to continue seeking their own individual counseling.
Thank you, Hasiba. My light is in yellow now, which means that getting towards the end of our time, we got perhaps one more quick question. I'll throw that to you, Elizabeth. Comes from Christine Wong and reads, how do you work with all family members to get buy-in before they attend family therapy sessions?
Oh, well, look, I work very hard to get everybody to come first up, because as soon as one person has come, I mean, that can be reassuring, because they can go home and say, look, I met her, she seems reasonable, you know, she seems like she'll be helpful. And so that might invite people in. But generally, I prefer to have everybody there first up together, because then they can all meet me and they can all talk about me. That's the one thing they've got in common, is what did you think and what did you think? So I spend some time on the phone just explaining, particularly for couples, that if one of you comes alone, you don't have that shared experience. And so to say, well, look, let's all step into the unknown. We'll all go and see if this is any use. We can all see together if we like this person and whether she can be helpful. So I try and just talk them round to start with, to say, you know, if you feel like you've fallen out with each other or you're not getting on, this could be the first thing you've done together in ages. It might, you know, even getting in the car together and turning up together, they've already achieved so much. So I do really sort of encourage that about, I mean, I may not say all of that because I wait to affirm them when they actually do it, but I just say, look, it's a great opportunity to start from an even playing field. Now, if someone says they just won't come, I will also say, when did you raise it? And they'll often, this is very common, they'll say, oh, during a fight last night, I said, I'm taking you to therapy, and everyone said, well, I'm not going. Now, that's not a proper offer, and it's not a proper refusal. So sometimes I just talk them through, how could you dial that down a notch and perhaps leave it a week and just say, look, I know that came up in anger, but I'd love it if we could work on this together, because I want better for our family. And I think we're not getting on well, and I feel stuck as well, and I want to get help. So I also maybe help them with the invitation. But in the end, if the person says, look, I want to come alone, I think what you can know from that is that they may be the person who most wants the help. And maybe they're blocking the others because really they are the ones who most need the help or want the help or have a private request. So then I just let it go through to the keeper and see what it all turns out to be.
Thank you so much, Elizabeth. Thank you so much, Hasiba. Incredibly powerful presentations and very, very interesting discussion.